So far, it's been good. I think we are winning on our side. We've had a few instances where we've lost people in the ICU, but we had more people being discharged, more people making a return to good health, more critically ill people walking around, initially seeing just gasping for air, but now breathing room air and are preparing to be discharged. So on our side, I'll say we are winning. But then, personally, it's been a bit scary with all the sensationalism added to this virus before it arrived in the country. Initially, I was a bit hesitant to volunteer, but then once I volunteered and I came into contact with COVID-positive patients, I realized they were just you and I, but they were ill. I get to see very, very critically ill patients, so I know it can be worse. But I've seen I've seen quite a number who have the mild form of the disease. So as much as it is, I pray that when I get infected accidentally or through God knows what, I should get a milder form of the disease. But as much as possible, I do take all the necessary precautions. I wash my hands, I always have a face mask on, and I'm in full PPE to see my patients when I have to.
I've been here for the past month. Initially, we were scared to come here, but after working here for the past 4 weeks, it's been an amazing experience having to help the nation. Knowing that this was the first treatment center and we were the first frontliners enlisted to help our country fight this virus. I think so far it's been an interesting experience. Most of our patients are doing well and we are happy with their progress.
Well, psychologically, yes. That's what I said from the beginning. We had that psychological effect. Going to the social media, the internet, reading all sort of outcomes from the COVID-19, which happened in other parts of the world. And then asking yourself, am I also going to face this kind of things? Well, we all know that this condition, it's something that we prevent with good hygiene. So when we started this work, we were very, very trained through the PPEs. We took a bit of a week or two. We had a lot of educations through the PPEs. Our health team and our preventive measures were put in place very well. So when we started, we got that bit of scare. And then as time goes on with teamwork and being there for each other, we got along. And I must say the psychological effects, we've overcome it, and now we are very comfortable working in this environment.
If you think you are really called to work in the health sector, I think this is the time you have to step in this COVID-19 pandemic season. People are scared. People think, oh, as you are taking sample, you also get, so some of the close friend crowd, if you are getting close to them, they will say, no, they have to be dodging you stuff. But I have a confidence that so far as I'm following my protocols, the PPE protocols, what I'm supposed to do before taking sample, after taking sample, what I'm supposed to doff off, I'm supposed to doff off in a way that I will not contaminate myself. I'm following it. So I have assurance that I'm safe. That's the assurance I'm getting within me. And the rest, I leave it to God. Because when you watch what is happening in the US, Italy, and UK, you realize that a lot of health workers, they get infected with the disease. You ask how come? Because sometimes you see them, all of them wearing their PPE and those stuff. I don't know how it happens, but me, I have a courage. I believe that God will protect me. So far as I'm also trying my humanly want to protect myself, He will also protect me. That's how come I'm doing this.